Hello, everyone. I hope you are all doing well and staying cool and hydrated. It is so dangerous in that heat. I try to stay in my house at this time between 11 and 6 if I can, because I can't handle it. I feel for you guys who are working out there in the heat, you guys who are working on the roads and construction and different things like that. Please stay hydrated, and remember, if it's not contraindicated for you, make sure that you have your salt and your potassium replacements like Gatorade or Powerade or something like that. So, those two are very important, and you lose them when you're sweating, and it can cause lots of muscle cramps and even renal failure, you guys. So stay hydrated. And if it's not contraindicated, make sure that you replace your electrolytes. Okay, to the story that I want to talk about. Have you guys heard about leprosy spreading in the United States? And Central Florida is the hotbed for leprosy right now. Who would have ever thought we would be speaking about leprosy spreading in the United States and being said to be endemic in one of our states, Florida? Now, it is here in Louisiana. There have been some new cases here in Louisiana and also in Texas, but Florida is the hot spot. So according to CNN.com, Central Florida is a hot spot for leprosy, report says. When a 54-year-old landscaper came into an Orlando dermatology clinic with a splotchy, painful rash, Dr. Rajiv Nathu took 5 or 6 biopsies. The rash was spreading from the man's limbs to his face, but previous doctors had been stumped by what was causing it. The biopsy results confirmed Nathu's hunch, a diagnosis he described as something you read in your textbooks, leprosy. However, the man didn't have the obvious risk factors that most doctors would expect with the hard-to-catch infection. So after noticing a cluster of other cases in the area, Nathu, a dermatologist and complex clinic director for advanced dermatology and cosmetic surgery clinics in Orlando, began to suspect that Central Florida could be an unexpected leprosy hotbed. Now, his team is cautioning other healthcare providers to be on the lookout for similar cases in the area. According to a research letter published by Nathu and his colleagues in the journal Emerging Infectious Diseases, Central Florida has reported among the highest rates of leprosy in the United States. In 2020, 159 cases were reported nationwide, compared with 200,000 new cases each year around the world, according to the World Health Organization. The new letter says Central Florida accounted for 81% of cases in Florida and nearly 1 out of 5 leprosy cases nationwide. Also known as Hansen's disease, leprosy is caused by the bacteria Mycobacterium leprae, which attacks nerves under the skin. Scientists aren't completely sure of how it spreads, but most believe that it's transmitted via droplets when an infected person coughs and sneezes. Its telltale symptoms include lesions and rashes that are numb or lack sensation because of the involvement of nerves. 9 banded armadillos in the southeastern United States can also carry the bacteria, and gene studies have linked human infections to the leprosy strains carried by armadillos. Although it's not always clear how humans encounter armadillo-carried bacteria, many patients can't recall ever having contact with the animals. The disease is not transmitted through casual contact like shaking hands or sitting next to an infected person. Instead, spread requires prolonged close contact with someone who has untreated leprosy over many months. According to the U.S. Centers for Disease Control and Prevention, roughly 95% of people aren't susceptible to the infection because their immune systems are genetically programmed to resist it. As a result, leprosy is a rare disease in the United States. Historically, most cases of leprosy in the U.S. affect people who travel to countries with high rates of disease or who are exposed to armadillos that carry the disease. And you guys, in a lot of other countries, like in Central America and South America, and some people in Mexico, they actually eat armadillos. It's like a delicacy. So maybe they're immune to it. I don't know, but this is scary. I've never eaten one and I never will. I have a little story about an armadillo and then I'll get back to the leprosy. A few weeks ago, my poor baby, my dog, Ozzy, he was outside early morning, like 4:30 in the morning. We let him out while I was getting dressed to go for my treatment. And my husband just heard a ruckus going on and he runs to see what's going on. And there's an armadillo or a raccoon. I don't remember. I think it was an armadillo because of the way he described it. They are the ones with the like the armor on them. So we had to take him. He couldn't walk. My dog could not walk. He couldn't jump. It took about maybe a whole month for him to start feeling better. And he was on medications, and he was on an antibiotic, and he was also taking gabapentin, or Neurontin is what some people call it. So be careful out there, you guys. If you see one of those armadillos, do not go anywhere near it. So some symptoms of leprosy: a spot that is red, darker, or lighter than normal skin color, growths on the skin, losing hair on your eyebrows or eyelids, curling toes or fingers, vision loss, and paralysis in hands or feet. So back to the article. There are cases in which doctors never know how a person was exposed. In certain states, we see more cases than others. Florida is one of them, said Dr. Linda Adams, chief of the laboratory research branch of the National Hansen's Disease Program, a federal program that coordinates treatment for Americans who are diagnosed. In all of these areas, we do see cases that we cannot explain. There's been no foreign travel, for example, or no contact with armadillos. The 54-year-old man in the new report told his doctors that he had never left the state of Florida and had no exposure to armadillos and no extended interaction with people from countries with high rates of leprosy, though he did spend a lot of time outdoors. About 34% of new cases between 2015 and 2020 did not have those traditional risk factors, according to the research letter. Instead, the people appear to have been infected locally, and finding that suggests that leprosy has become endemic in Florida, the letter says. Oh my gosh. Experts agree that leprosy is becoming endemic in the region, but that need not cause a public health panic, said Dr. Nicole Levine, chief hospital epidemiologist at the University of Florida Health Shands Hospital. Endemic simply means there are regular levels of a disease in a region, but not that rates are climbing, she explained. It's really rare still, Nathu said. These numbers are still relatively super low here. We're not that concerned with it. Well, he's not concerned, but I'll be damned. I won't be going to Florida. I will not. So what do you guys think? This story goes on and on and on and on and on. And it's super long. You guys can go to CNN.com and read the story about, leprosy. But let me know what you think about it. in the comments, have you ever known anyone with leprosy? Are you a person who's eaten an armadillo? Have you ever seen one, been around one? And if you have, what are your thoughts on that now, right? Okay, let's talk about this in the comments. And another thing I want to say before I let you guys go, isn't this strange? All of these diseases and crazy weather happening, one thing after another. Let's get our lives together, people. Let's make ourselves right and whole, and make sure that the people we love and care for know that we love them and we care about them. Let's fix relationships that, like family members and loved ones, because we never know what is going to happen next. I'm going to be bringing you guys another story that I think you should listen to. There's some crazy stuff happening in this world. Let's talk about this crazy thing, leprosy. And if you live in Florida, are you scared or not worried at all? Let's talk about it in the comments.